Well, Professor Rudo Mathivha, head of the ICU at Chris Hani Baragwanath Hospital, says she does not believe the public health care facilities are prepared to deal with another rise in COVID-19 hospitalisations. Professor Mathivha says that the Department of Health needs to ensure that all public health care facilities are fully equipped to deal with an increase in COVID-19 patients.
We have already seen a change in the demographic profile of COVID patients. We are seeing young 20s to just over late 30s presenting at our hospital with moderate to severe COVID disease, and some of them needing critical care intervention. Of note is 65% of those have not been vaccinated, and the rest have only been half vaccinated. So took the first Pfizer jab, and we're still thinking of going for the second Pfizer jab. I am worried that as the numbers go up, the public health care institutions are going to be overwhelmed. And I see no preparation in getting those institutions ready for a surge response. And that is one thing that we should also be concentrating on. We know we've got a new variant. We may be debating as to how it's going to behave, but worst case scenario, it hits us as Delta hits us. And then we will have a problem with bed numbers. In terms of imposing restrictions, that ain't my field of expertise. And I think there are a lot of a number of people and ministries that would have to gather and discuss that and see when they should put in restrictions. But my 5 cents worth of it is when we get pressure on COVID beds and on critical care beds, getting the trauma ICU patients out of the picture really help ease the pressure on beds for COVID patients and for non-COVID patients. So that is something that we could look at. Yes, I understand the economy may be threatened, but we will still need people to live through this to be able to carry out the economy. I do agree with what has been said about the new variant, about countries giving us the red sign. And I do believe that they're being irrational. But we're caught in this net. And we just better figure out how to get out of it in a dignified manner. But let's look inwards. How do we manage the sick people that are going to come in? How do we attract those young people that do not want to be vaccinated to realize that they would want to be vaccinated now? Because that is where our strength will lie when those young people come and be vaccinated. Then the pressure on the beds will ease off, because we'll see mild to moderate disease, or we will see people that don't get that sick at all.